I want to talk about the PNP part of your life now, that mental health side of things. So you said that you saw this deficit in support and help and providers in the mental health space.
Yes.
What was it that you saw, and what are you doing now in the space that you saw?
Was a huge lack of access. So people could go see their primary care, but always wasn't able to see a psychiatric nurse practitioner or even a psychiatrist, because there's just very few of us, to be quite honest. So family practice has done a great job at integrating and trying to meet the needs of this population. But what happens if somebody's severely sick or the provider's not really sure, then a lot of times they go untreated. Or there is a dual diagnosis situation where there's a lot of substance abuse. And in that case, they fall through the cracks due to their own dual diagnosis, if you will, when you have a substance abuse diagnosis with coinciding with a mental health issue. So there's a lot of moving parts to it.
How is the conversation started between the patient who comes in for maybe a physical situation, and then it possibly pivots into a little bit more mental health? How do you bridge that gap?
Well, at Evergreen, they do an outstanding job in screening. So if you make an appointment to see your primary care, oftentimes they do what's called a PHQ-2, which is a basic screening about a mood. If you score positive, and it's basically 2 questions, then we move them to a PHQ-9, which really kind of speaks to depression, and then we have another one that speaks to anxiety. So the primary care providers actually are the ones that can filter that out. And that's where I often get most of my referrals.